Journal RX, an app that tracks mental health in order to improve pediatric cancer treatment and reduce the lifetime burden of trauma and depression that many patients experience. Right now, 50% of lifetime mental illness begins by the age of 14. It then goes up to 75% by the age of 24. Only 51% receive treatment, which then leads to a $1 trillion a year loss from the global economy each year. I was surprised when I saw that every 3 minutes a child is diagnosed with cancer. That then leads to 300,000 a year globally, and 1/3 of patients treated for cancer in a hospital have a mental health condition, and children are a lot more susceptible to this. I personally saw this firsthand when my little sister was diagnosed a few years ago, and while she luckily always had someone with her, most kids don't, and it made me realize that there really isn't any tool available for tracking a patient's mental health when they're diagnosed, treated, or recovering from cancer, and so that's what inspired this project.
So as Mariana mentioned, there is a lack of solutions throughout the pediatric cancer treatment process. There are several standalone solutions, like general mental health trackers such as Daily Journal, treatment trackers like Care Clinic, and medical or mental health AI chatbots. There are also EMR systems on the provider side, but there is no integrated solution for pediatric cancer. And so the value that we are trying to add is for the ability to track mental health, mood, and pain all in one app through a daily check-in to catch mental health issues before they actually progress in these patients, and to make this data accessible for care team treatment management. And so we would also add detailed treatment plan functionality to improve patient-provider communication and understanding to ensure that patients and providers are on the same page throughout the treatment process. And finally, we would try to incorporate our solution into current EMR systems to make this data as accessible as possible for providers.
So we've already talked to some nurse practitioners and social workers who said they would have a daily need for a product like this. We've teamed up with Memorial Sloan Kettering Cancer Center, who agreed to provide us feedback as we build out our prototype, and also allow us to work with their adolescent and young adult program for user testing so we can start collecting data. As we move into prototyping and user testing, there's two main categories of risks and unknowns we'd like to address. The first one is securities and legalities. So that's making sure we do everything possible to flag any suicide alert, making sure we maintain compliance with all hospital regulations, including HIPAA compliance, and also making sure we're protecting any personal or private data and information. The next main category is creating meaningful engagement. So this is just ensuring that patients are engaging with their emotions in a healthy way, and that also we're collecting the most meaningful data for providers so that they can incorporate it into their patient's treatment. So exploring this category will help us decide what sorts of prompts and questions to include in daily check-ins with patients, what sort of response options will allow them to respond to those questions with, and the exact data that we'll collect and how we'll present it to physicians.
So as we start with our first experiment, we're looking at current tools used in hospitals. So a few of them are PHQ-2 and PHQ-9, which screen for depression. So we're looking at those and how they are mapped out. And then we're also looking at CDC suicide guidelines for risk and preventative factors. And along the way, we're talking to psychiatrists, social workers, and nurse practitioners at a few different hospitals. So then as we're talking to these providers, we're using this to show them how it'll adapt based on the patient's feedback. So if they say they're feeling well, we can kind of move on. But if not, we want to be sure to kind of figure out as much as we can what's going on so it adapts according to the child's mood that day.
So the next step, we'll build a website version of the prototype to be compliant to the regulations. And the first part of it was we'll do some mock-up on the front end and understand what functions do we need to include in our prototype. And the second part, we'll do the backend design part that we will implement the backend with Flask and also MySQL databases and deploy on AWS. We've also derived 3 other experiments that are based on our key risks and uncertainties. So these experiments are mostly related to how do we keep and provide engagement for patients while they are doing a daily check-in every day. And also what kind of interface do we want to have for the providers to provide them with a platform that is more convenient and useful.
So here's a broad overview of our roadmap. We're currently in the research and development phase for our prompts. We're planning on curating a set of questions and then interviewing mental health professionals to make sure that they're appropriate and effective for our age group of 13 to 18-year-old patients, and also interviewing physicians to make sure that the questions will yield helpful data for them. With that set of questions, we'll build out our low fidelity prototype webpage, and then we'll take that prototype to hospitals to get hospital and parental approval. Again, we're working with MSK Cancer Center and their adolescent and young adult patients. And so with those groups of patients, we'll conduct patient focus groups and gather more physician feedback. And then in parallel, we'll also be interviewing lawyers to make sure that we can build out our app in a way that keeps privacy as an utmost concern, and also make sure that we're compliant with all hospital regulations and begin applying for patents. And then using our feedback from both those avenues, we'll continue iterating and building out our app model. Thank you.
Okay, let me go first. What's the business model here? Who's going to pay for your service?
So we're planning to go through hospitals, and from the physicians I've talked to, they said that if the data they'd be gathering could then be used for research. So we're planning to go through that as far as profit.
They don't have such a service right now? The providers?
No. From everyone that I've talked to, which is a handful of people from a variety of hospitals, there is nothing like this. They have the paper format that they fill out, but they said it's hard to keep track of, and that this would help on a daily basis.
Is it more towards the health of the patient or care for the patient on a regular basis?
Yeah, so it's a little bit of both, because I've seen how much the mental health affects the physical health. So a lot of the time that's not really caught until it becomes a bigger issue. So this is to kind of a preventative tool to then manage it along the way rather than waiting until it accumulates and affects them physically.
Yeah, I think it's a good novel idea in terms of helping the patients, in terms of their health and things like that. But from a commercial standpoint, I had a few things. One, integrating this with the providers, and two, who's going to pay for the service from a consumer standpoint? Is the insurance company, provider, patient, who's going to be billed? The provider does it. So if it's so expensive in terms of providing this service, it's going to be a regular monitoring and providing service. If something happens, there is another service that needs to be provided. Yeah, it's extremely good. Integrating with Apple Watch and things like that may be for future consideration for you guys to do it. More, virtual care is becoming more and more relevant right now. Integrating to the virtual care, and they can get to the doctor as and when required, and the monitoring, automation monitoring and data synchronization may be a better way of automating the system to make it more productive and efficient. I think but that's a few comments from my side.
Thank you.
Selling. Sorry. Go ahead, Oded, please. Go ahead.
Just to point out a few things. So you mentioned cancer. Is that because they are under some sort of a surveillance or hospitalized? So it allows the hospital or to create some sort of a tracking, or it's just because of the numbers?
So it's mostly because they're inpatient for a long period of time. So if they're undergoing chemo surgery and then chemo, which is one of the more traditional routes, it can lead up to over a year where they're in the hospital and then they're in and out for a while. So it's just such a long process, and they're completely thrown out of their element. So this is just kind of a way to help them manage it along the way, because it's not ending. Once they find out, it's not something that ends anytime soon.
Right. So it's the purpose for inpatient.
Yes.
Right. So the monitoring will be by the staff, the caregivers, hospital professionals. Gotcha. So the engagement is supposed to be daily. and you were thinking of, so what would be, so day has got like 24 hours. And as we know, we're changing our moods, and we have some events could occur during the day. How could you, were you thinking of that?
That's a good point. There would be an opportunity, I think, to do like kind of a morning and a night check-in. I think that's something we would talk to psychiatrists about to see kind of how they think that would play in. Because that is a good point that we haven't really fully addressed yet, but that would be something we're thinking about.
Gotcha. And what do you think will be the right time? Like, what will be the enough data that you would say, okay, will be the metric, the measurements in the sense of
Yes, I think it'll kind of create a baseline as they start going. So when they first start, we would have kind of a initial eval to figure out like how much we would need from that patient to accurately monitor their mental health going through the treatment. So I think it'll kind of depend on the patient, and it might also vary on age, because our age gap is from 13 to 18. So it could be, we could see it be different in one end to the other, I think.
Right. I think one of the biggest challenges, to break down a day, and what exactly that means. And the second is, to hustle the caregivers with another assignment. That'll be something hard to establish, as far as I know. And maybe the interaction should be, directly with the patients. So maybe to find a fun way to engage with some sort of like, I don't know, a nice app, whatever that. I'm just thinking out loud.
Yeah, we're actually thinking, because once they finish their daily check-in, we want to make sure we give them something to kind of go off of immediately. So suggesting like a meditation app or something like that if it's more of a mild case. And then we have thought about making sure the data is integrated into the EMR system so that it's not more work for the providers, because that's the last thing we want to do.
Right.
And the doctors we talked to, or nurses especially, were saying that the AYA programs are the place to focus, because this would help them with developing their programs. So we definitely want to make sure we're not making more work for them.
That's cool. All right, thanks.
We had tried to sell a similar tool for patient engagement for seniors to get on the other side of the spectrum to hospital systems who are in a Medicare program called Medicare Bundle Payment for Care Improvement. It's a weird Medicare program, but basically it's tough to sell to hospitals because, unless there's direct revenue tied to something, they don't always like to invest. It took us 3 years to get a deal with the largest, public hospital company, HCA. It took us 3 years, and it was only like a $4,000 a month deal. So it's selling to hospitals is a pain in the butt. However, we have worked with other companies in this other cancer program, more of a over 65 population for cancer. And there's a company called Navigating Cancer you should check out, navigatingcancer.com, where we kind of admire because they had this business model, which we thought was clever and maybe a little bit like too capitalist around getting money from pharmacy companies. They were giving the tool away for free to engage the population with patient engagement, patient monitoring, population care. They gave it away free to doctors and the patients, and they got money from pharmaceutical companies. They have a ton of money and are super desperate to pay for data about how their drug is doing. Maybe not just for clinical trials, but they're just desperate for data so they can compete in this multi-$100 billion business. So you might look at their website, navigatingcancer.com, and see how they're doing. I know they collect data and they basically sell it to pharmaceutical companies, which is, I guess, an evil, because not evil. In some ways it's evil. I don't know. It depends on how you want to look at it. But they are paying cash. They are giving a value-added service to patients and doctors, and they are de-identifying the data and sending it back to pharmacy companies who are desperate to know how people react to their drugs. And I think that will be true in this market as well.
That's a really, really good point.
But it's not a condoning or I'm not supporting or against that business model. I'm just saying that's a business model that's out there where pharmacy companies will pay cash for this type of data.
Yeah, there's a fine line there for sure.
Caregivers may be another business model to give it to caregivers, instead of hospital, because they are the one care providers to the patient, because that's part of their process, and giving an additional facility for them to monitor it. Are you thinking of other illness as well, or this is starting point?
Yeah, so I think starting with the kids because they're at the most susceptible age group, but they're able to kind of give us honest feedback. And then I would want to expand to younger as well as older and also specialize in like breast cancer and stuff like that to kind of tailor it to each age group or type of cancer.
Are you guys trying to pilot something with a couple of patients or something like that?
Yeah, so we connected with the head of the AYA program at Memorial Sloan Kettering Cancer Center, and they said they would give us feedback as we're prototyping, and then we could work with their program to get user data, and then kind of build from there.
Okay, good luck.
Thank you.